Hi everyone! Have you ever felt nervous about speaking English at the doctor's office?
You're not alone. Today, we'll practice simple English you can use at a clinic or hospital.
Let's start with something easy. What should you say when you arrive at the hospital?
A simple greeting works well. You can say, "Hello, good morning, I'd like to see the doctor."
What if you don't have an appointment?
You can politely say, "I don't have an appointment, but I need to see a doctor."
That's clear and natural. What's your name? How do you answer?
Simply say, "My name is David Lee," or whatever your name is. Then they may ask for your ID.
Now you're meeting the doctor. What's a common first question?
Doctors often ask, "How can I help you today?"
Or, what's the problem? Don't worry. Just, what's the difference between I'm sick and I don't feel well?
Both are correct. "I don't feel well" sounds a little softer and is very common in everyday English.
Let's learn some useful symptoms.
You can say, "I have a headache," "I have a fever," "I have a sore throat."
These are some of the most useful expressions. How about stomach problems?
You can say, "My stomach hurts," or "I have a stomach ache." Both sound natural.
What if you have a cough?
Say, "I have a cough," or "I've been coughing for 3 days." Adding the time gives the doctor more information.
Here's a pronunciation tip.
Listen carefully. Fever, not fever with 2 strong parts.
Say it smoothly, fever. Sometimes the doctor asks, how long have you felt this way?
You can answer, "For 2 days, since yesterday, since Monday."
Simple time. Here's a common mistake.
Many learners say, "No, I am fever."
The correct sentence is, I have a fever.
Remember,
Can you describe pain more clearly?
Yes, you can say, "It hurts here," "My back hurts," "My knee hurts." Pointing to the painful area also helps.
What if the pain is very strong?
You can say, "The pain is getting worse." These expressions sound natural and clear.
Doctors also ask about medicine, don't they?
Exactly. They may ask, "Are you taking any medicine?" You can answer, "Yes, I am," or "No, I'm not."
Here's another useful question.
The doctor might ask, "Are you allergic to anything?" If the answer is yes, simply say, "Yes, I'm allergic to penicillin," or
Let's practice. Ask and answer aloud.
"Ready? What's the problem?"
Pause and answer in a complete sentence. Speaking builds confidence. So, after the patient explains the problem,
What might the doctor ask next? The doctor may ask, "Where does it hurt?"
what if the pain comes and goes?
That's easy to explain. Say, "The pain comes and goes."
That's much more useful than just saying it hurts. How to describe the pain itself?
Sure, you can say, "It's a sharp pain," "It's a dull pain."
Or it's a burning pain. So we're giving the What about pain that gets worse when you move?
You could say, "When I move," or "The pain gets worse when I walk."
That's a very practical sentence. Now imagine the doctor wants to examine you. What might they say?
They might say, "Please sit here, take a deep breath."
Or open your mouth. Those focus on one common instruction. Take a deep breath.
Right, the doctor may say, "Take a deep breath in."
Then breathe out.
Exactly.
What if you don't understand instruction?
Never be afraid to ask. Say, "Sorry."
Could you repeat that, please?
That's polite and completely normal.
Yes. Let's practice that expression.
Imagine the doctor says something too quickly. You say, "Could you repeat that, please?"
And don't worry about making a mistake. Sometimes the doctor may want you to get a test.
The doctor might say, "I'd like a blood test."
And the patient can ask,
"Why do I need this test?"
what other tests might you hear about?
You might hear blood test, X-ray, ultrasound, or scan.
So if the doctor says you need an X-ray you're talking about, what can the patient ask before having a test?
You can ask, "Do I need to prepare for the test?" Or "Do I need to fast?"
That's especially useful if you need to stop. Let's move on to medicine.
They might say, "Take once a day."
And what does twice a day mean?
It means 2 times each day. For example,
What if the doctor says take it after meals?
that means you should take the medicine after eating.
And before meals means before eating.
Exactly.
Here's a common mistake learners make with medicine.
They sometimes say,
What's better?
"Usually, I'm taking medicine," or "I'm taking this medicine."
What if the patient is worried about side effects?
They can ask, "Does this medicine have any side effects?"
That's a very important question.
Simply say, "Could you explain that, please?"
Let's make it a little harder. Pause and answer aloud.
You could say,
Yes, some medicine for my cough.
or "No, I'm not taking anything right now."
Great, say it out loud. I have a bad cough.
Do you have a fever or a sore throat?
I have a sore throat, but I don't have a fever.
Good. That's a clear way to describe symptom.
What should we listen for?
Listen for simple phrases like, "You have an infection," "You need some rest."
Focus on the key instructions. What's the difference between you should rest and you need to rest?
"You should rest" is advice. "You need to rest" sounds stronger and means it's necessary.
What if the doctor tells you to drink more water?
You should drink plenty of water.
And if you want to check, you can ask, how much water should I drink?
Exactly. Asking questions.
What about getting more rest?
The doctor might say, "Get plenty of rest," or "Try to get some sleep."
These are everyday expressions, not complicated. Now let's talk about follow-up appointments.
The doctor might say, "I'd like to see you again next week." Then the patient can ask, "When should I come back?"
Perfect. What if your symptoms don't improve?
You can ask, "What should I do if I don't feel better?"
That's an excellent sentence to remember.
Yes, it helps you understand what to do next.
Let's learn another useful phrase. It's getting better.
Right, you can say, "My cough is getting better, feeling much better."
And if things are getting worse?
Say, "It's getting worse," or "I'm feeling worse."
What do you say if you suddenly feel very sick?
If it's an emergency, be direct. Say, "I need help. I have severe chest pain."
Short sentences are best. Let's talk about pronunciation for a moment. How do we say medicine?
Say it like this, "Missin."
Not medicine, with every letter strongly pronounced.
Exactly.
What about the word symptom?
It's pronounced symptom.
So not symptom.
Right, try it, symptom.
Symptom.
Okay,
I'll be the doctor.
and I'll be the patient.
How can I help you today? I don't feel well.
I have a feel well.
For 2 days.
For 2 days. Excellent. That's exactly.
Let's continue the conversation.
Are you taking any medicine?
No, I'm not. Should I take anything?
Let me check your symptoms first.
That sounds much more natural than trying to memorize. David, if learners are nervous?
Don't use difficult English. Use short sentences and your symptoms.
So simple English works.
Exactly. Clear is better.
Imagine you're at the doctor's office right now.
I'll ask the answer aloud.
What's the problem?
How long have you had it?
Are you taking any medicine?
Pause and answer.
Let's review today's phrases.
I don't feel well. I have a headache. It hurts here.
Use these confidently for a doctor's visit. Remember, you don't need perfect English.
Keep practicing and it'll become more natural.
Don't forget to like and subscribe. See you next time. Bye.
Bye.